Unit Vcs02, Lesson 1. Today we are covering Learning Outcome 1 and Learning Outcome 2. The aims and objectives of this session are as follows. Learning Outcome 1 ensures that you will know the types of basic medication, routes of administering said medication, and safe handling and disposal. Learning Outcome 2 will cover how to store, use and administer medication in line with legislation and also veterinary instructions as appropriate. Please note in follow-up to this lesson there is also another related video PowerPoint and 2 related handouts. Within the handouts there are aspects to be completed to aid your knowledge and understanding. First of all, just some RCVS guidance for you to be aware of. Despite the training that you're undertaking at this point in time, in veterinary practice you will be classed as an unqualified or a lay person. It is normal practice for veterinary practices to employ a range of people, and that will include veterinary surgeons, veterinary nurses, student veterinary nurses, VCAs, patient care assistants, receptionists, etc. Now, regardless of any training or experience such staff may have had, if you don't fall under those initial 3 titles of veterinary surgeon, veterinary nurse or student veterinary nurse, in the context of veterinary practice you are classed as unqualified. Your job title should not be misleading and should reflect your role, and also the fact that you are not one of those 3 types of qualified staff. You should not be termed as a veterinary nurse unless that person is actually appropriately registered and qualified with the RCVS. The RCVS does recognise that veterinary surgeons may wish to delegate certain tasks to unqualified members of staff. There is no legal dispensation in the Veterinary Surgeons Act for a veterinary surgeon to delegate to a lay person. This means that unqualified members of staff have no legal dispensation to undertake delegated medical treatments or minor surgical procedures, regardless of how well trained or experienced they are considered to be. Now, in the absence of any legal basis for such delegation, and with the aim of preserving animal welfare, the RCVS advice is that any delegation to a lay person needs to be justified and is a matter of professional judgment in any individual case. The veterinary surgeon should first of all risk assess it, and the delegation should be reasonable in all the circumstances, not put the animal at risk, and not amount to more than minor medical treatment of the sort which an owner could undertake. So, for example, the administration of uncomplicated oral medications or subcutaneous medications. That is not to say that your experience or knowledge would mean that you couldn't actually do more than that. What this advice and the RCVS is guiding veterinary surgeons on is that they need to be able to clinically justify that delegation, and that at your point in time of your training, you are perfectly within your rights to be able to carry out such simple tasks that an owner would be able to do at home. That doesn't mean that over your time in veterinary practice, if you advance your qualifications further, so such as becoming a student veterinary nurse and then becoming an RVN, that obviously then in that context you would be able to build on those skills and actually be able to carry out more complicated procedures, so such as intramuscular injections, intravenous blood sampling, to name just a few. But at this point in time, please understand that the minor medical treatments will be all that come under your umbrella from a veterinary surgeon's point of view for delegation. As we've already said, the veterinary surgeon needs to consider those circumstances and not just the procedure itself. The veterinary surgeon needs to have regard to the following: the actual nature of the task and how complex it is, the individual animal concerned, so the animal species, its condition, any likelihood of complications, and also the owner's wishes. The individual staff member, so they would look at you yourself in relation to your training and experience, your confidence, your willingness to accept delegation, and awareness to be able to seek assistance when required of a qualified colleague, and also how available such assistance is. Again, it is not fair for a veterinary surgeon to delegate a task where there wouldn't be appropriately qualified staff members around to assist you. The RCVS also considers that there are certain tasks that should not be delegated to unqualified members of staff. So intramuscular IV injections and invasive procedures such as the introduction of an IV catheter or the passage of a urinary catheter. This is due to the complexity and the theoretical knowledge and also practical skill in such an area. Think about how you would like your animal to be treated, and I'm sure that will help you comprehend the reason behind this. People's pets are not to be treated as a science experiment. We need to consider their welfare at all points in time, and that welfare is key. So we can't just practice on them and make them into a pincushion. That would not be appropriate. Veterinary surgeons should generally ensure that the client is made aware of any procedures to be performed by practice staff who are not veterinary surgeons where appropriate. Overall, in such an instance, the veterinary surgeon remains responsible for their decision to delegate to unqualified members of staff. Should a delegation decision become the subject of a professional conduct investigation, the RCVS would consider the reasonableness of the veterinary surgeon's decision. A clearly reasoned and recorded decision should therefore be behind every delegation to an unqualified member of staff. Further information about this can be found on the RCVS website if you wish to look into it further. Importance of following the RCVS guidance. As we've seen in the previous slides, the RCVS sets out lots of guidance for our veterinary practices and our veterinary surgeons in particular to follow. This is done in order to support those working in veterinary practice to follow what we deem as appropriate practice or gold standard. To summarise your role in relation to this, you can most certainly assist. And in some cases, if the veterinary surgeon in charge deems that you have the appropriate training and also the knowledge, you could potentially administer basic medications via routes that would be utilised by the pet's owner, such as orally, subcutaneously and topically. Training and knowledge on such practices is a must, and your mentor will support you with this alongside the rest of the qualified team. Learning Outcome 2. Assessment Criteria 2B relates to administering medication under supervision according to current medicine regulations and veterinary practice protocols, such as oral and topical. You will need to be able to select the correct animal and site of administration, select the correct needle, syringe and medication, and prepare the equipment required for the administration of said medications. This may also consist of selecting the correct animal from your kennels ward and taking them to the veterinary surgeon, RVN or SQP. You will likely be required to restrain the patient appropriately to support the qualified staff member administering the product. This will enable them to have access to the appropriate site, such as subcutaneously into the scruff, for example, and to securely restrain them to prevent the patient being harmed or panicking themselves, and potentially in doing so harming your colleague or yourself. This will reduce the risk of being bitten or scratched. As we said, you may be asked to prepare the relevant equipment, such as selecting and appropriately putting together the needle and the syringe in a sterile manner, pill popper for administering tablets, locating and then double checking with qualified staff the medication ready for use. As I said, it is quite normal practice for you to be the person assisting in relation to restraint. That would enable another staff member to carry out the administration of the medication. Or, as long as the veterinary surgeon deems that it is appropriate for you to do so, due to your theoretical knowledge and also your practical skills, it may be yourself administering such medicinal products. Remember, you must follow instructions from qualified staff at all times, and that it is really important that you understand the correct methods for doing so. Oral medication is to be given via the mouth. What happens with this is that it is then absorbed through the GI tract into the blood circulation, and we term this a systemic effect. That is because it's then systemically transported around the body using the circulation. Others may have a local effect, such as laxatives that act on the GI tract and aren't absorbed into the circulation. Topical medication is given via the body surface, so such as the skin of the body. Think about worm and flea treatments that are spot-ons, or sprays. Ears, consider cleaning agents, liquid drops, antibiotics, and application to the eyes. Rectal medication is given via the rectum. Subcutaneous injections are given via the subcutaneous tissue, usually into a place such as the scruff of the neck where we'd have a loose piece of skin in order to utilise. Now, when carrying out the administration of the medication yourself, you will need to do the following. Use the correct handling and restraint equipment and technique appropriate for the animal and site of medication administration. Now remember, if you are going to be administering the medication, you will need to utilise another staff member to restrain the animal safely and appropriately for you. It may be that in practice you see colleagues carrying out medication administration by themselves. However, at this point in your training, it is far more appropriate for you to ensure that your restraint technique, i.e. 1 or 2 staff members to assist you, depending on the animal's temperament, is more than appropriate. You will need to carry out the safe and correct administration of an oral and topical medication to an animal, and this will be under direct supervision of a veterinary surgeon, a veterinary nurse, or an SQP. So, coming back to oral medication. Oral medication is going to travel through the body using the GI tract. They're absorbed by the intestine, they pass through the liver before reaching the blood circulation, and this allows them to reach the site of action, i.e. where we need for that action to take place. Advantages: they're easy and convenient to be administered in the home, allowing possible long-term medication to be administered by the owner. Some disadvantages of oral medication are the absorption and distribution of the drug is slow in comparison to other routes. We can't use an oral medication in patients that are vomiting or unable to control their swallow reflex or are difficult to administer to, i.e. have an unsuitable temperament. Some medications need to be given with food and others require an empty stomach, and that's certainly very important to remember when being involved in administering medications. Others can cause irritation to the GI tract, such as vomiting and diarrhoea, especially if used alongside other drugs. Gastric acids can destroy some drugs, so you'll tend to see that oral medications have a coating on them to help to protect them, to enable them to get to the site that they need to. And some medications may be broken down by liver enzymes before they can reach the circulation. So we do have a really good advantage there, but also some disadvantages to take into account. And it's really important that when prescribing medications that a veterinary surgeon takes on board such aspects, that they look into the drug, any interactions with other drugs, consider the individual patient, what is an appropriate treatment, but also their current status as well. So what can we use to assist us in relation to administering oral medication? Well, you may have seen or used these already, so we can use little pill givers or guns, people may call them in practice. They're really useful as we can place the tablet into the pill giver and we can target it at the back of the mouth. Very useful when trying to administer to cats, especially naughty cats. We can, as long as the veterinary surgeon has ensured that the medication is appropriate for it to be done to. In some situations we can crush the tablet into a fine powder and then we can mix it into food or make it into a paste. We can also use pill splitters and that will enable accurate dosing. Again, the veterinary surgeon will need to check the medication data sheet to see if that is actually allowed and that it's not going to cause any negative effects of that medication. And for birds we can use crop feeders or feeding tubes, are especially useful for exotics such as snakes and tortoises. What I would like you to do now, using your online resources, textbooks and also your knowledge from veterinary practice, is research and detail the correct technique for the following. the administration of a tablet and or capsules, and the administration of liquid preparations. When doing so, I'd like you to think about safety of the patient, so the appropriate technique, any points of note within the mouth that we might wish to use, any aids that could assist us for those animals that are more difficult, and also safety of the personnel in doing so. So think about how you can safely carry it out, but also the restraint methods that are going to need to be used as well. What I would like you to do that is detail that correct technique, and you can use images, etc. to dictate or show what you are discussing. And again, that will be a task that I would like for you to upload onto one file for your veterinary educationalist to look at. Topical products are used directly on the skin, eyes, ears, and mucous membranes. We mainly use them to treat local conditions. Consider that some preparations may actually be absorbed through the skin into the systemic circulation. Examples of those are worming or flea products. We must at all times, like with any medications, follow manufacturer's instructions regarding how to administer, and also the frequency in relation to how often we should be applying such a medication. Some products will contain steroids. However, it is vitally important in all cases that we do wear gloves to protect ourselves from the drug, so such as those that do include steroids, and also actually from the condition that you are treating, and so that we don't cause any contamination of the site. We'll need to be able to provide advice and demonstrations to clients for correct application so that they can do so appropriately at home. And we must monitor the patient for any reactions, whether they be local or systemic, and that is via the skin absorbing it, or by licking the site of application, which is not ideal at all. What I'd like you to do now is research and detail the correct method of administration for eye ointment administration and liquid eye drop administration, and again explain health and safety reasonings in relation to restraint of the animal, how you would carry out the administration itself, and also find some associated images to depict what you are explaining. When we use the term parental injection, we are referring to the term injections. So this is in relation to actually administering an injection into the skin or other format of the body in a manner that must actually use sterile equipment. We can't introduce unsterile injections, so the actual needle itself or the syringe, to that sort of site, because we could cause more harm than good. When it comes to parental injections, with some products there is actually more than one route that can be used. So we must always, and the veterinary surgeon must always relay to us the actual appropriate administration route. Here are some further examples of parental administration. They include intravenous, intramuscular, subcutaneous, intraosseous, epidural, intrathecal, intradermal, intraarticular, intraperitoneal, intraarterial, and subconjunctival. When it comes to parental administration, and again our veterinary surgeons should be considering this in their initial choosing of a product and also the route, we need to bear in mind the animal as an individual. Consider its species, its breed, its temperament, and also how we're going to maintain an aseptic technique, and also the skills of the staff administering such a medication. And as we've said, such routes, other than subcutaneous, would only be able to be carried out by a qualified member of the team. I would like for you to research the routes provided, and this may be in one of your task sheets for you to complete, so you have an understanding of the routes that we're talking about. So those terms or routes that we've talked about there are very key, so make sure that you have an awareness of where they are, and also pros and cons, advantages and disadvantages of them is really important for you to understand. As we say, at this point in your training, it is not relevant for you to be giving other than subcutaneous parenteral injections, but if you are going to be advancing your studies further, this will be very useful for you to know for future studies. So subcutaneous being our point of focus, we generally use the scruff, which is loose skin at the back of the neck. It's the most common used site in relation to parenteral administration. And we do allow owners to perform such administration at home. For example, think of your diabetic patients. However, it is vitally important that the owner has had appropriate training and is competent to do so. The absorption into the circulation can actually take around 30 minutes. Common sites for IM injection are the quadriceps and the lumbodorsal muscles. We do have maximum amounts that we should follow in relation to administration into one site. So the maximum amount for administration into a cat is 2 mils and 5 mils for a dog. However, bear in mind the size of the animal and seek clarification if you are at all unsure about the amount to be administered. Common sites for IV injection in dogs and cats are the cephalic in the forelimb, saphenous in the hind limb, jugular in the jugular region of the neck, and sublingual, so the lingual site in the tongue. We also utilise the auricular vein in the rabbit, which is within the ear. And this will deliver this medication directly into the circulation so it can work instantly. In saying that it works instantly, please note that obviously it's going to depend on the quality of the patient's circulation. So it might be that you see two sides of the story really. In a young, healthy, fit animal, a product such as an agent being injected into the cephalic vein for an animal to be induced for a procedure might work instantly. If we were to compare that maybe in relation to a euthanasia situation where we've got an older and collapsed animal, that may take slightly longer to work. So it does vary and it depends on that individual animal's circulation and the quality of it. I've just provided some links for you to utilise here in relation to correct administration of various types of medications. So the first one is oral medication with a syringe, so liquid medication, oral medication in the form of a tablet, and there's a range of techniques provided there. How to bath a dog, cleaning a cat's ears, and medicating a dog's ears. So it may be that you want to watch those to build upon your knowledge of practical administration, and it might also be that you want to utilise these videos to aid the previous tasks as well. I would also like for you to research and detail the correct method for administration of intravenous products. Learning Outcome 2, 2G, relates to carrying out the monitoring of an animal during and post administration of a veterinary medication in accordance with the veterinary team instructions. This is going to be something that you carry out in your practice with a patient. You will need to be able to monitor the animal for the following: any side effects. So be aware of the data sheet for the product. Such data sheet is easily found within the original packaging. Also, our formularies are very useful as well. And it might be that expected side effects are things such as nausea or vomiting. An adverse reaction is something that we would not expect. It is not a normal side effect. So an unexpected or dangerous reaction to a drug, such as swelling of the face, the body, excessive salivation, just to name a few. You are going to be responsible for monitoring, recording and reporting to the veterinary surgeon aspects such as those listed below. This is just a few. Any signs of discomfort, any vomiting, pyrexia, so high temperature, any tremors, any salivation, general increased temperature, pulse rate, respiration and mucous membrane colour. Although slightly Learning Outcome 2 covers criteria 2E, prepare medication for dispensing, and 2F, demonstrate safe use of current legislation for the supply, sale and use of veterinary medications. As part of this, we're going to cover how to calculate the dose in order for you to dispense correctly and be able to advise clients on the correct administration procedure. Be able to select products and containers for dispensing appropriately, so considering the drug group and their actions in the most appropriate format of dispensing a product. Be able to handle drugs safely for dispensing, so consideration of the related legislation to include COSH, Misuse of Drugs Act, Medicines Act and the Veterinary Medicines Regulations. Produce correct labels containing all of the relevant information that is required, and also be able to advise owners appropriately as well. So as part of the veterinary team, it is important that you, under the direct supervision of the veterinary surgeon, the RVN or SQP, can calculate the correct dose, dispense correctly and provide accurate detailed instructions for the owner on correct administration procedures and any special considerations or precautions that they may need to be aware of. Such information can be gleaned from the data sheet that's supplied with the medication, and that provides appropriate dose rates, instructions for use, etc. Our veterinary surgeon in charge of the case should also advise you on such administration instructions. You'll need to provide instructions to the owner as per the information provided to you, i.e. from the veterinary surgeon, and this is done normally in a verbal manner, and it should also be further backed up by written instructions on the label and also a medication sheet or chart. The more information that a client has got or written form of instructions to back up verbal instructions, the better. You'll probably find in your time in veterinary practices that very often clients have a lot of information to take on board in a very short space of time, and they don't always listen in the manner that we would wish for them to. They may be distracted by their pet, but also they may forget what we told them, and consideration of the sort of client that you're dealing with is really important as well. So if we can verbally clearly explain, clearly demonstrate and provide written medication information sheets or charts to back it up, the better. Special considerations and precautions are really important to explain to the client. So considering the type of medication that you are dispensing at that point in time on behalf of the veterinary surgeon. So some people are allergic to certain types of antibiotics, so all those warnings will be on the medication packets. But again, by talking to the client, making sure that they're aware of those and actually checking is really important. Providing gloves to be worn when administering products is really good practice as well, especially, for example, if they're administering a steroid cream, as that steroid could actually be transferred through the, onto the client's skin through that application. You need to be able to select the correct medicinal product and the most appropriate container. Such products would include, or can include, tablets, capsules, creams and pastes. Also liquids as well. And you should be able to choose the most appropriate container. That's going to depend on the nature of the product to dispense. So these can include things such as coloured fluted bottles to prevent the product from being exposed to light, plain glass bottles where applicable, wide-mouthed jars, which are usually in a plastic format, paper or board cartons or wallets, Consider that only tablets in blister packs can go into something, such as that we cannot dispense loose tablets into such a format. Again, we may need to utilise glass or plastic or metal containers, and all containers that are going out should be safe. So we must have a means of, child-proofing that container and reiterating to the client the importance of keeping out of reach of children. Again, the qualified team will be able to advise you on this. I would like for you to complete the related research task in the accompanying handout in relation to this subject matter. Again, you also need to have an awareness of common drug groups and their actions. Within the accompanying handout, please highlight key points of the provided information, and this will give you a good basis of understanding and knowledge about this area. It is vitally important that you handle drugs for dispensing safely. You must also ensure that you follow the related piece of legislation. COSH dictates that you should follow standard operating procedures, risk assessments that have been carried out in relation to this, use any required PPE as deemed appropriate for that type of medication, and any other relevant control measures to ensure your own safety and that of others when handling medicinal products. The Misuse of Drugs Act 1971 controls drugs that could be dangerous or otherwise harmful. Because of this, it categorises drugs of this nature into controlled drugs and their schedules, and that is in relation to the harm that they could cause. So in relation to any input into these sorts of products, they must be appropriately recorded from a legal point of view in a controlled drugs book, depending on their schedule and classification, and also they must be stored securely. It is unlikely that you will be dealing with controlled drugs at this point in your training. However, you do need to have an awareness of this Act and also an awareness of the type of drugs that might come into context of that. And it would be something that you would see qualified members of the team dealing with. The Medicines Act 1968 is an Act of Parliament, and it governs the control of medicines for human use and for veterinary use. And that also includes the manufacture and supply of medicines. So that's an overall piece of legislation to be aware of. And then we also have the Veterinary Medicines Regulations. This is updated annually in the UK, and they provide a single comprehensive set of controls on all aspects of veterinary medicines. The regulations are reviewed, consulted upon and replaced on a regular basis to ensure that they are up to date and fit for purpose. And overall, its purpose is to ensure safety, quality and efficacy of veterinary medicines. VMD ensures such criteria is met. So that's basically making sure that we're using safe, quality and effective veterinary medicines that are safe and fit for purpose for our animal patients. Learning Outcome 1, 1.F. It's important that you produce correct labels. You must be able to correctly complete a drug label including the following information: client details, animal details, date of dispensing, name, address and qualifications of the veterinary surgeon, directions for use, name of the product, where the product is to be used, i.e. what route, precautions to include keep out of reach of children for animal treatment only, the quantity of the drug, the strength of the drug, dosage instructions to include how frequently, i.e. once a day in the morning, twice a day, one morning, one afternoon, for example, and also PPE instructions in order for the product when handling. Many practices will have a label printed that will produce an awful lot of this information for you. However, you may need to add to it, and also in situations where technology fails us, you may need to use indelible ink to record such instructions onto a label. Labelling. As such, there isn't actually a legal requirement to label veterinary medicinal products, or VMPs as we term for short, if they are supplies in their authorised and original packaging. However, the RCVS requires labelling on all dispensed products, and that is because it is considered best practice to do so. So ultimately, because of this, we do send every medicinal product out with a label on it. If we are sending products out in their original containers, we mustn't actually obscure any information such as batch numbers and expiry dates on that packaging. There is usually an area where a label can be supplied. And that is because it's an offence for such information to be obscured, and certain information such as batch numbers and expiry dates are really relevant for us to be able to have a look at in case of any issues with a batch or in order to check expiry dates of products. The RCVS Code of Conduct actually reiterates to veterinary staff that medication must be packaged in appropriate containers, i.e. child safe, making sure they're not exposed to light if they're light sensitive, etc., and with said labelling. And the practice standards scheme can also advise practices on what should be included in the label, because there isn't actually any specific requirements in the veterinary medicines regulations or in the RCVS Code of Conduct. To meet legal requirements, the following can be done. We can label the product, and we should label the product. We can provide and should provide a copy of the package insert, which is a form of the data sheet, to the client, so they have all the information about the product that they are administering to their animal. And any products that are provided under Cascade must be labelled. When we're talking about Cascade, we're talking about something that is in place where we haven't maybe got the most appropriate form of a drug to go out to a patient, i.e. maybe the product that the veterinary surgeon is needing to use is actually a product that's designed to treat another species. Maybe we've tried species-specific alternatives and they haven't been appropriate. So in relation to Cascade, clients actually have to sign a piece of paperwork to say that they're willing to use an item under the Cascade. Cascade products must all be labelled. So it is hard just to send out such products like that and then not label anything else. And that is why overall we just label everything so that everything has appropriate labels, everything is explained to our clients appropriately throughout. I'd like you to have a go at the related label task in your handout. Advising owners. During your role in veterinary practice, you'll probably be regularly involved in advising owners. When doing so, you must ensure that you do the following. Provide accurate and correct information. Please bear in mind, if you cannot provide accurate and correct information because you don't know the information required, then you must seek advice from a qualified member of the team. This is clarification. You can explain to the client your role and why it is so important for you to do so, in order that you don't give them information that they could misconstrue, could ultimately be harmful to the animal's welfare, etc. So if you're at all unsure, you need to make sure you actually clarify with qualified staff, as any incorrect advice or inaccurate advice or guidance could put the animal's welfare in jeopardy. And that relates to lots of aspects of veterinary practice, but in particular in relation to what we're talking about at the moment, the safe handling and administration of medications. You may have heard in your time in veterinary practice of people relaying stories about where clients haven't listened appropriately, or the person giving the advice hasn't given correct advice. And you do hear of it happening. You may all have heard of the story relating to a diabetic owner explaining really enthusiastically to the veterinary surgeon how well they injected the dog or cat orange with the insulin and then got the dog to eat the orange. Obviously that wasn't what we wanted for them to do. Whoever has performed that demonstration has used an orange but hasn't actually explained to the client, I'm using an orange in place of injecting your pet. So we must make sure that everything is really clear, really accurate, so that such things don't occur. We should provide the client with and then advise them on the correct and safe use of PPE. Provide them with information about appropriate storage instructions and disposal, i.e. storing in the fridge if required, storing out of reach of children, and also what to do in relation to waste disposal. And we generally would get clients to bring it back to the practice to be disposed of. And again, such information can be found in the product data sheet that goes home with your clients. We should be given that information so that they've got all of the information they require, and you can utilise it, and also the qualified team members to be able to advise you appropriately. As a member of the team who will probably do a mixture of nursing and administration duties, you will likely be involved in receiving and unpacking veterinary drug and medication orders. As part of that role, you will need to ensure that you complete the following. Rotating of stock. So when unpacking an order, we must always ensure that older stock is used prior to new stock. So we can do so by checking the expiry dates, and then we place them appropriately on the shelves in relation to date order. positioning that new stock behind the old stock to ensure that things don't go out of date, they get used in the appropriate order, and things are used appropriately throughout their journey in the practice. You may also assist with stock ordering and will need to maintain and adhere to the relevant stock levels, which should be explained to you or may be on the system that you're using. You may also be provided with a list of relevant stock levels. You must always ensure that you follow correct storage and dispensing requirements, for example, placing an item immediately into the fridge if it requires refrigeration. Ensure that you dispose of medications appropriately as per practice protocol, and the correct use of the dupe bin. And we have provided in previous lessons the BSAVA waste guide, and that's really useful. Also within your practice, you've probably got some information from your waste disposal company in relation to what can go into what. So we used to use the term dupe bin, so you may be very familiar with that. However, we should now be using the term pharmaceutical waste bin. So that is a normal means of disposal for our pharmaceuticals, whether they be damaged, out of date, whole stock, whatever, they would go into that waste bin. You should note and check the quantity received in an order and ensure that it tallies with the quantity ordered, and obviously report it to a senior or qualified member of staff if there are any inconsistencies, so that can be picked up with the distributor. And you'll need to check and record your batch numbers and expiry dates, name and address of the supplier or recipient, and each practice will have their own means of doing so. So it might be that that's done on the computer or using tools to check products in that does it for us, and you must make sure that you're aware of that. You will be involved in assisting with calculating the correct dosage for tablet or oral liquid medications and injectable medications in accordance with veterinary instructions. So we're going to move on to that now. Calculating the volume of a drug or number of tablets required. We use the following formula. So the dose prescribed in milligrams divided by the concentration of dose per mil or tablet. Here's an example of a tablet or capsule calculation. A cat with a dental infection requires antirobe, which is also known as clindamycin hydrochloride. So to obtain the dose prescribed by the veterinary surgeon, we must multiply the animal's weight in kilograms by the dose per milligram. You know the cat's weight to be 2.5 kilograms. So we times that by the dose rate of 10 milligrams per kilograms. That equals 25 milligrams. The capsule actually comes in a 25 milligram capsule. The veterinary surgeon has instructed to you that he wants the animal to be tableted once daily to get that dose rate into the animal accordingly. So that would mean that the animal would need one capsule once daily. And let's say if we were needing to administer over a period of 7 days, which is quite a normal length of duration, we would need 7 tablets. An example of an injection calculation. The veterinary surgeon has requested that you calculate an injection of Carpreve or Carprofen for an inpatient. To obtain the dose prescribed by the veterinary surgeon, we must first of all multiply the animal's weight in kilograms by the dose rate required, i.e. the dose per milligrams. In this situation, the dog weighs 25 kilograms and the dose rate is 10 mg per kg. So we would do 10 times 25 equals 250. Now, at this point in time, we're dealing with an injectable format, so we have to consider the drug strength within that format or that concentration. And here we're dealing with 100 mg per mil. So we divide the mgs required by the concentration. So we divide 250 mgs by the 100 mg per mil equals a calculation of 2.5 mils administered to the dog. Within your adjoining handout, I've provided you with some examples also, and this is something that you can be carrying out on a regular basis in practice with your mentor to become proficient at such calculations. This is just your first few examples and your first go at it in your adjoining handout, but it is important that you have an awareness of how to carry out such calculations, and especially if you are going to be progressing with your role over time and doing further training.